Another unwanted record for New South Wales.
There were 1,029 cases of community transmission.
The state's health system under serious strain.
We have 698 people admitted to hospital and 116 people in intensive care, 43 who require ventilation.
And there was bad news beyond the Western Sydney hotspots, with the regional lockdown extended until at least September 10.
We are on a knife edge in the regions. We need to take pressure off the health system.
But after New South Wales administered its 6 millionth vaccine dose earlier this week, the Premier made good on her promise of a reward for double-vaxxed citizens. Sadly, for shaggy-haired Sydney-siders, rumours that hairdressers would reopen were wide of the mark. The Premier offering picnic privileges instead, starting September 13.
If you live outside those areas of concern, so long as the adults are fully vaccinated, 5 people can gather for an outdoor gathering. In the local government areas of concern, families, a household, will now be able to go out for an hour of recreation on top of the hour of exercise.
And with the PM pushing his reopening plan all week, Gladys issued this statement of intent.
We're asking industry to dust off their COVID safety plans, get the QR codes in check to get ready for when we are 70% double vaccinated. That's when things will start to open.
But with daily infections moving into the 4 figures and 70% vaccinations still so far off, are we getting a little ahead of ourselves?
Epidemiologist Professor Nancy Baxter joins us now. So Nancy, Gladys Berejiklian promised some new freedoms today. They were announced. What did you think of them?
Well, she announced them, and I think she was kind of boxed into a corner, having said for so long that there was going to be some treat for the people of Sydney that have been vaccinated once they reached the 6 million jabs. But, you know, if you look what she's actually given them is not for several weeks, and it's pretty minor. I think she had a long talk with her Chief Health Officer, Carrie Chant, about what actually could be done and not kind of risk fueling the outbreak that they have in Sydney. And given that they're now at over 1,000 cases, you know, I think Gladys was told there just wasn't much that could be done. So what they tried to do was implement things that had the least chance of kind of fueling the pandemic. So, you know, they got outdoor activities. We know there's been outdoor transmission of Delta, but we know it's much safer. So small groups, and even in the high-risk LGA, it's just your own household. Basically, all it says is that you can go outside and have a picnic.
Yeah, but that's not an insignificant thing, it seems to me. I mean, especially with policing. I don't know, if you turn up to a park and there's 1,000 people there, how do you figure out whether they're all vaccinated? I guess we'll wait and see. But how would you assess, how significant would you assess the increased transmission risk is?
Well, I think that if everyone's doing the right thing and you basically only have vaccinated people and only small groups of 5 in the LGAs that aren't high risk, the risk of transmission is relatively low, but it's not zero. So I think that it might be something that you would think about when you had, you know, the effective reproduction rate. Then you remember that's the number of people that one person with COVID infects. And so when it's down below 1, it means your outbreak is decreasing, not increasing. You know, if you were kind of at that level, then maybe, you know, easing these restrictions in ways that give people little bits of freedom but aren't going to kind of cause the outbreak to explode again, that might make sense. But that's not where we're at, you know, and it's not even like it's just the cases going up. It's not the hospitalizations and the ICU admissions. We're now seeing hospitals in crisis in Sydney. So, you know, I think that these things probably would have been better to talk about in 2 weeks if things were looking better. But I think Gladys kind of had herself in a corner and had to announce something. So she announced kind of the safest thing she could possibly think of.
And Nancy, it comes on a day where we pass more than 1,000 daily cases, and the Premier is still refusing to give specific details on exactly how these numbers are rising, how people are catching COVID. In terms of getting on top of this, how helpful would it be for the wider public to have those details?
Well, I think having more information would help people understand how the pandemic is growing and understand what their role is in keeping things under control. You know, they have press conferences. They're getting longer, you know, an hour today. And honestly, I listen to them at double speed. I listen to a recording of them at double speed because if you miss something, it's not really going to matter. They don't really communicate much at these press conferences. And in fact, when they've tried to tell us where people were contracting COVID, it's been a bit of a disaster. disaster. You know, initially earlier in the pandemic, earlier in the outbreak, they were continually blaming people in certain areas for doing the wrong thing, when in fact they were essential workers and they were contracting COVID at work and bringing it home to their families. Then you have, you know, most recently, you know, talking about COVID spread at a legally held funeral and comparing it to an illegal house party in Sydney. You know, they seem to kind of muddle the message. They don't seem to really clearly talk about risk in a way that people can act on it, or at least understand why they're in lockdown. So I'd say from a communication standpoint, they're really not succeeding with those press conferences.
Nancy, and that goes hand in hand with this next question. It feels like the focus has really shifted. We're now focusing on this 70% or 80% number of the eligible population, and we've gone away from the focus on getting those vulnerable groups vaccinated. We've still only got 1 in 8 Indigenous people vaccinated. How at risk are they right now?
Well, it's absolutely shocking, because Indigenous people were in our high priority groups. So these people were supposed to have been a focus for vaccination already. We shouldn't be worrying about them. We had plenty of vaccine to make sure that the Indigenous people and Indigenous communities that are particularly vulnerable, really isolated communities with limited medical resources, were vaccinated. But I want everyone to think about that 80% number, because that's 80% of adults. So that's actually 64% of the Australian population, meaning over a third of Australians are not going to be protected at that number. So we really need to make sure that we're targeting specific groups that are at higher risk to make sure they're protected before we think of opening up at that low a vaccination rate.
Nancy, I think your framing's been really beneficial. Thank you very much for speaking to us. From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.